Mendelson said, I am a cancer survivor, as I'm sure several of you are. And I was diagnosed when I was 12. We were actually in Steamboat Springs, Colorado, at a baseball tournament. I was there with my parents and my brother. And between some of the games, we decided to go horseback riding. So on the way back to the stable, about 100 feet away, my horse goes nuts. Bucks me off. We think that I've broken my hip. So I get ambulance to the nearest hospital, the whole 9 yards. They run some tests, and send me back to Texas on crutches. So I go back, and once I get off my crutches, my hip's fine, but my left foot is now hurting. So we go to a specialist in Houston, who told me, sure enough, you have broken your heel bone, and it's because you have what's called a unicameral bone cyst in your heel bone. A benign bone cyst, not a huge deal. We treated it, did surgery on my foot, and my doctor released me. I was big into gymnastics. Released me to go back to tumbling, back to gymnastics. And so when I did, my foot was still bothering me. So we went back to the doctor, ran some more tests, and I was sent to a orthopedic surgeon at MD Anderson, one of his colleagues. She again said, unicameral bone cyst, not a big deal, we'll take it out and get you back to gymnastics in no time. During the surgery, they biopsied the cells, and it turned out that I did have cancer. I had Ewing sarcoma, the type of bone cancer. My dad said that he knew something was wrong whenever she came out 30 minutes into a 3-hour surgery. It's not usually a good sign. So they got me started on chemotherapy that next week. Everything just moved really quickly. I lost my hair the following week, was pulled out of school. And I guess about a month, I was diagnosed in January, and they told me about a month after that, that due to where my cancer was and the type of cancer that I had, the only treatment option for me to fully eradicate my cancer would be for them to amputate my left leg below the knee. And that was a tough pill to swallow. You know, cancer is something that I saw as being able to get over and to live my life, whereas with an amputation, that would be a daily reminder of my cancer for the rest of my life. But thank goodness I did it, and they amputated my leg on May 3rd of 2000. And after that, I had a few more rounds of chemotherapy, and I started working with physical therapy. I got my prosthesis, worked on rehabilitating myself. They taught me to walk again and then to run again. Then I learned to tumble again, and didn't get back in gymnastics, but got into competitive tumbling, competitive cheerleading. Was with my varsity squad at my high school, doing cheerleading with them. And then once I graduated, I went to the University of Texas, and tough time in any college student's life. I had to pick a major. So I really kind of did some soul searching and decided what I wanted to do. And through my cancer experience, to me the nurses were the ones that were holding my hand the whole way. And whenever I was really sick or really down, they were the ones that would listen to me, hear me out. They saw me as a normal 12-year-old girl, didn't stare at my bald head. And so I really decided that this is something I'd like to do and that I feel like I could be good at. So I went to UT's nursing school, got my degree, and whenever it came time to pick a job, obviously there's nowhere else I'd rather work than MD Anderson. So I took a job on their pediatric unit, like Dr. Mendelson said. It's the same unit that I was treated on, and it's been the best experience.
Hey, we're here with Shelby Robin, a registered nurse at MD Anderson and a cancer survivor. Mm-hmm. You caught cancer when you were 12, correct?
Right.
Okay, can you tell me about the highs and lows of
Sure. The obvious low was my treatment. Whenever I was told that I had cancer, that was a little bit of a curveball. And being a kid, I think I sort of didn't know the gravity of the word cancer. I just knew that my life was going to change big time. They told me I was going to lose my hair. That was probably one of the biggest lows. Being a 12-year-old girl, losing my hair just seemed like the end of the world.
Right.
So then going through treatment, I mean, it was tough, but MD Anderson was so great about kind of holding my hand the whole time, getting me through it. And I think the high for me has been working with the kids now. Getting to see their journey and the highs and lows of their journey, I think has been my high.
Right,
yeah.
right. You're in a unique perspective.
Mm-hmm.
How does that affect your work as a nurse?
I'd like to think I can relate with my patients. I've been through a lot of the same stuff that they've been through or that they're going through. So I think it hopefully helps them for me to tell them I've been there. You know, I've
right.
had this drug, I've had this chemo, I've had that surgery, and I'm living a completely normal life now.
Right.
So I'd like to think that kind of helps.
Cool. What's next for you? Is it doctor? Is it astronaut?
Yeah, I don't know. I'm young. I'm trying to keep my mind open. I think eventually I'd like to go back to school and do sort of the more behind the scenes medical side of it.
Right.
But I've got plenty of time. I'm in no hurry. I love what I'm doing.
Absolutely, cool. Tell us a little bit about your involvement with the Children's Art Project and the Sunshine Kids.
Both two programs that I'm really passionate about, and they're similar in the way that they connect kids with other kids that are just like them. I think the Children's Art Project is so good about, I don't want to say getting the kids' minds off their cancer, but helping them to focus their energy on something positive. They're constantly up on the floor doing artwork with the kids, big projects. They also take them on trips. Whenever I was a patient, I went to numerous trips with them, like to SeaWorld in Texas and petting Shamu and stuff like that. But I think the key is that they connect them with other kids. They're normal again. Everyone on the trips are bald. A lot of kids have amputations. So they get to be normal again.
Right.
And the Sunshine Kids also is a group that takes kids with cancer on vacations basically all over the United States and let them just do really neat things. I mean, they go to DC and meet the president and go to LA and get to be on the set of a TV show and stuff like that. So they're getting to do really neat things. And again, being normal again, getting to meet kids that have gone through stuff that they're going through.
Right, absolutely.
I think that's huge.
And that's obviously very fulfilling for you.
I love doing it. Right. Yeah.
You're obviously an inspiration to cancer survivors worldwide.
Oh, thank you.
Who's your inspiration?
The kids I work with, honestly. They constantly remind me why I'm doing what I'm doing. And to see them be going through something so tough and that no one should ever have to go through, but be coloring in a coloring book with a smile on their face. I mean, it's just, it warms your heart and it keeps you grounded.
Cool. Now I understand you have as many prosthetic legs as I have guitars.
Yes.
Tell us about them. What do you use? Which ones are for what?
So I have a high heel leg that I'm wearing today, and I call it my Barbie foot because it's constantly in a high heel position, so I can kind of shove it into heels whenever I need to whenever I need to wear high heels. I have an everyday leg that's called my multiflex ankle.
Okay.
Basically, it's good for walking. The ankle moves a little bit, so it makes walking a lot smoother, a lot easier. And so I wear that one every day. I have a swim leg that's waterproof, so I can submerge it in water and not worry about any of my components rusting out or anything like that. And the skin on it's really good, so it looks good. And then I have an active leg. I was a big tumbler, gymnast, and cheerleader in high school. So I have a leg that has a shock absorber in it. So whenever I tumble, it kind of helps me absorb some of that shock with my landings.
Okay. Do you feel that it's affected your life? Do you feel like you've benefited now? Or that seems like a silly question, but
I feel like it hasn't held me back at all.
Right.
There are certain things I'll have to find out a different way to do them, or kind of tweak things, the way I do things a little bit because of it. But as far as being able to do things, I can't think of anything it stopped me from doing.
Right.
Yeah.
You're a test runner for Lifelike Labs.
Yes.
Tell us a little bit about that. How?
Well, I did that a lot more whenever I was younger, and it was so neat because Lifelike Labs, my good foot, they would take a mold of my good foot and then flip it and make a mirror image of it, and then make a prosthetic to match that, and then I sit in their office and they sort of hand paint it and airbrush it with me sitting right there. So it's just a really neat experience. And I've been really blessed to be able to they make skins for prosthetics. So to be able to get a skin from them has been a huge blessing for me. Yeah.
Cool. Okay, so to cancer patients and loved ones who'll be watching this video, what are your words of advice? What would you tell them? What's your message to them?
I would say hang in there. That's my biggest message. I think whenever you're in the midst of treatment, you can just become so overwhelmed by it that light of the tunnel gets smaller and smaller and smaller, and you feel like it's never going to be over, life's never going to get back to normal. And coming from someone I'm 11 years out now, and I don't have any lasting, I lead a completely normal life.
Right.
So I would say hang in there, know that it's going to get better, it will get back to normal, I promise.
Cool.
Yeah.
Cool. Shelby, thank you very much.
Thank you for having me.
It's been a pleasure.
Yes.